to your head and neck assessment. How you doing today? I see. I hope by the time you leave this assessment, feel even just the littlest bit better. Now, if I could just have your name and date of birth. Wonderful. And is that your preferred name? And how do you like to be addressed? Wonderful. So, for this head and neck examination, we are going to be doing quite a comprehensive number of tests. So I will be looking at your scalp, your hair, your skin, eyes, nose, mouth, throat, the ears, and the neck. So I'd like to start by taking a look at your scalp and your hair. Is that all right with you? Do you mind if I touch you? Wonderful. Thank you. So I'm going to start by just taking a look at the head and just making sure that everything looks generally symmetrical. Good. Just going to get a little closer here. Look around, noting your features and just the general view. Good. I'm just going to take a look at your hair and note the texture. Touch windy out there today, isn't it? Yes. When those heats kick up, it can get quite windy here. And really that's much better than if the air was stagnant. Just taking a look. And I'll be able to untangle your hair a little bit. There's just a few little knots from that wind. And let me take a piece and I'm just going to test the strength of it. Good. I'm just taking some hair, winding it around my finger and pulling on it. Have you noticed if you are having quite a lot of hair shedding or loss at all? Good, good. And one more strand here. Good. So hair is strong. And I'm going to come in with this comb right here. My little pick is going to be my primary tool. I'm just going to look around in the hairline first. We are looking for signs of skin conditions. We are looking for possible infestations of the louse variety. And skin abnormalities like lesions. Good. In here. Just part there. combing that out a little bit for you. Good. Taking another look here. There we go. Just a bit of detangling. In here. Go. Take some of those hairs and part them. Good. Excellent. Alright, so let me bring them back. And let's take this part of the hair. Now I'm just looking at the part of the hair and taking a little bit of hair, separating it. Good. I'll bring that back. And just comb that down. Other side. Just taking a bit, parting it, separating and parting. There. Good. Let me bring that back. So now that lays all nice and straight. Now I'm going to move into palpating the head. Oh, you'll feel my fingers just firmly pressing around the head. Making sure that all our hills and valleys are where they're supposed to be. Good. Occiput here, the parietal bone here, temporal back here, sphenoid, frontal, all our borders. Good. And everybody seems to be sitting just fine. So let's take a look at your skin. And I'm going to bring, where'd it go? There we are. Just going to bring the magnifying glass in. We're going to have a little look at the skin. If you had any issues with your skin as of late. Good. Taking a little peek. Luckily it's nice and bright in here. We don't need to bring in the focused light unless I see anything out of the ordinary, of which currently I'm not sighting. Good. Good. we are going to move on to your sinuses, your lymph nodes, and some of the muscles of mastication. So, for the sinuses, I'm going to be pressing in around our different cavities here, and just let me know if you feel any pain or tenderness. I'll start here at the frontal sinuses. Sinuses are named after what area they're in. We have the frontal bone here. Any pain or tenderness with this? Good. And the ethmoid, right at the nose here. Good. Any pain or tenderness? Good. And the maxillary. Just press in. Good. Excellent. Now, I am going to be directly percussing on these areas, so I'm not pressing and releasing, but instead tapping along the areas. Keep catching my glasses there. I'll be tapping along those areas. Just let me know if you feel any pain. We'll start right here. Any pain or tenderness here? Feeling all right here. Good. Now the ethmoid. Good. And the maxillary. Wonderful. So for the lymph nodes, I'm going to start at the back of the head, here at the occipital nodes, and then bring it around to postauricular behind the ear, preauricular in front of the ear, submental and submandibular under the jaw, and the anterior cervical, posterior cervical, and deep cervical chain on the neck, and supraclavicular above the clavicle. Good. Now for our muscles of mastication, we have the Masseter and the Temporalis are our two big superficial muscles. We have some deep muscles, but these are the ones we're going to be working with. I'll also be working with the temporomandibular joint, or the TMJ, in here. If I could have you clench the jaw and unclench. Good. Clench the jaw and unclench. Okay. At the temporalis here, if I could have you clench the jaw and unclench, clench, and unclench. And now for the joint, I could have you open the jaw and close the jaw. Good. Open the jaw, close the jaw. All right. Any pain, tenderness, restriction in movement? No. Very good. So let's take a short break. And I'll jot down some notes as we have done quite a bit of examination. Now I'd like to take a little look at your eyes. I'm going to get up real close and I'm going to be looking at the tissues of the eye, like the tear ducts here, the lower eyelid, upper eyelid, sclera, iris, pupil, the lashes, the eyebrows, and the orbital ridge. Just going to take a peek around here for any color abnormalities, skin abnormalities, loss of hair. Good. I'm going to palpate around the orbit here. Any pain or tenderness here? Excellent. I'm going to pull the upper eyelid up. If I could have you look down. Look down, down, down. Good. And if I could have you look down, or rather, I'm going to pull down, you look up. There we go. Lower eyelid goes down, look up. Good. Excellent. The conjunctival tissue looks nice and pink there. So I am just going to grab my pen light here. We are going to test your pupillary response. If I could have you just look at my nose here. Just want to make sure that your eyes, your pupils more specifically, are equal, round, and reactive to the light. Come a little closer here. Good. Just keep looking at my nose here. Excellent. Switch to the other side here. Keep looking. Good. Equal, round, reactive to the light. A little closer here. There we go. Good. And you can take a few blinks if you need to. I'm just going to put this down for a moment. And I am going to have you follow my finger here, using only your eyes without moving your head. I could have you just go side, up, down, to the middle, other side, up, down, back to the middle, side, the middle, side, up, down. Let's go diagonally up, diagonally up, good, diagonally down, diagonally down, diagonally up, diagonally up, diagonally down, diagonally down, good, and then up, down, up, down, up, down. Keep following the finger as it comes in and out, in and out, in and out, and switch right over here, in and out, in and out. Wonderful. If you want to take a moment to just get a few blinks in, that is absolutely no problem. And then we will test your peripheral fields. We're going to do the finger wiggle test. Ready? Wonderful. I'm going to have you keep your eyes right here. I'm just going to be wiggling my fingers in your periphery here. Or like this. Right? Just keep your eyes right here. Let me know when you see my fingers wiggling. Good. Yep. Yep. Good. Yep. Good. Excellent. Yep. Good. 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 Yep. Excellent. Now we are going to do a cover test where I'm going to cover one side here, or rather you are going to cover your eye. I'll cover my eye. You just let me know when you see my fingers come into view. So if you could start with covering this eye right here, and I'll cover the same side here. Just let me know when you see my fingers come into view. Keep your eyes right here. Good. 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 Yep. Good. Good. Now we'll switch to the other side. You cover this side, I'll cover this side. Let me know when you see my fingers come into view. Good. Good. Yep. Good. 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 Finally, for the eyes, we have a fundoscopy, which means I will be looking at the fundus of the eye. The fundus of the eye is a fancy term for the back of the eye. I'll be using my ophthalmoscope here. I am going to be putting my hand atop your head here so that I can make sure I'm not going to run into you. I am looking for what's known as the red light reflex. When I see that, I can come in real close and look at the fundus of the eye. So back here we can see the optic disc, which you might know a little bit better as the optic nerve, and the blood vessels, the tissues here. See the back. Good. Flip to the other side. Just look for the red light reflex. Coming in at an angle, then coming up. There we go. Just looking at all the tissues here. Checking on the health of the eye. There we go. Good. Excellent. And that's all there is to it. You have quite a nice looking fundus there. Not sure if anyone has ever told you that before. Now let's look at the nose. We're going to start with a cranial nerve test. So, I have a little dish that has some different scents. I want you to take an inhale and tell me what you smell here. Can you tell me what you smell in this dish? Good. It's citrus. And another one. About this. Cinnamon. Excellent. And you could just hold one nostril closed. What can you smell here? Peppermint. Good. And if you could close the other nostril, occlude one of the nostrils there. And what does this smell like? Good. That is isopropyl alcohol. Wonderful. And so I'm going to take a little look at your nose with the otoscope. Switch out the heads here. You don't have to hold your nose closed anymore. I will have you do that again in just a moment, but not right now. There. Otoscope is on. If I could just have you tip your head back. Just tip that back, and I'm going to look inside of the nostrils, the nasal passages. The otoscope is not going anywhere near inside the nose. It's just a little bit light. Let me see. The septum and the tissues inside the nasal passages, and if I squint, I might see a bit of the turbinates. Good. And now, I'm going to have you occlude the nostrils again. So if I could have you just take a deep breath in and out without covering the nose and all. And out. Good. And if you could cover one side and take a breath in and out. Good. And the other side. You could switch to the other side. Take a breath in and out. But rather through your nose, rather than your mouth like I did. Good. Is there any difficulty between the two? Are they both equal? Good. All right. So, nose looks good. We are going to move on to the mouth and throat. Just going to have you open your mouth here. And I'm going to take a look at the tissues inside the mouth and at the teeth. Good. Right, and if I could have you lift your tongue to the roof of your mouth. Good. Excellent. And if I could have you stick out your tongue as far as you can, we're going to flatten the tongue so that I can take a look at the throat wall, at if the tonsils are present or enlarged, inflamed at all. Look at the uvula. Good. And could you say ah for me? Very good. And you can close your mouth, and I am going to have you try to take a dry swallow. The uvula and the swallow test are testing cranial nerves 9 and 10, vagus and glossopharyngeal. You could try to take a dry swallow. There you go. Good. So that is all good. And lastly, with the mouth, we're going to test cranial nerve 12, the hypoglossal rather, not the glossopharyngeal. And I'm going to have you stick out your tongue. And can you lift it upwards, down, to the side, the other side. Wonderful. And that's it. You can go ahead and put your tongue back in your mouth. And we'll take a look at your ears. Pop my speculum on here. Get that ready. I'm going to have a little look at your ears. Any issues with hearing at all? No? Good. Any problems with the ears? Any itching, irritation, feelings of fullness, any pain? Good. Good. Let me take a peek inside for a moment. There we go. And pull the ear up and back. Good. Other side. ears look great, and I'm going to do just a little hearing test for the vestibulocochlear nerve. So just let me know what you hear in each ear. And how was that? Okay, good. So hearing's pretty good because I was a little bit soft. And then we are going to test some of your sensation and motor functioning with the trigeminal nerve, the facial nerve, and the accessory nerve. So I have this little brush and this little pointed tip. I'd just like you to tell me if you feel the brush or the tip. You can say soft or sharp, just to make it easier. I'm going to test these on your jaw just like I did, so you know what you're supposed to be looking for. Soft. And that's sharp, right? Okay, just let me know what you feel. Sharp. Soft. Soft. Sharp. Sharp. Soft. And did both of those sides feel similar? Good. Sharp. Soft. Sharp. Sharp. Soft. Soft. Good. And did both of those sides feel similar? Okay. Sharp. Soft. Sharp. Soft. 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 Sharp. Good. Put that back in my little secret compartment of my reflex hammer here. Very handy for storage. And for the facial nerve, I am going to have you do some facial expressions so we can test the motor function of the nerve. I could have you lift your eyebrows. Good, and squeeze your eyes real tight. Open them real wide. Good. Can you puff out your cheeks? Good. And can you smile real big? And show your teeth. Good. And can you frown? Can't do that one on command. Never have been able to. Good. Okay, so all that's good. Now for the accessory nerve, I am going to have you shrug your shoulders. That's it. Real easy. Just lift your shoulders, bring them back down. Up and down. Good. So that one's all good. Lastly, we're going to be moving on to the neck. I'm going to start with our stethoscope. We are going to listen for any bruits or audible heart murmurs, because if I do hear this, I'm not going to want to be touching around the neck. So, just going to put this on your carotid artery, and if I could have you take a deep breath in and hold and breathe out. Deep breath in, hold, and out. Good. So that was real simple and easy. I have you hold your breath so that I'm not listening to when you breathe, and instead I can focus on the sounds of blood flow. So now we're going to do a little bit of palpation here, and I'm going to start with the trachea and the thyroid, as well as palpating the carotid artery. So let's start with the carotid, and you can breathe normally here. Okay, good strong pulse there. Excellent. And we're going to make sure the trachea is midline. This might be a little uncomfortable. There we go. And I'm going to have you take another dry swallow while I feel for the thyroid. You can take your time. It's hard to do one dry swallow, let alone a second. Just like that. Good. There we go. Excellent. Now I'm going to feel around the muscles here. We have the hyoid bone, so we'll have the suprahyoid muscles, infrahyoid, we have the SCM or the sternocleidomastoid, we have levator scap, for example, scalenes. Just going to take a little feel of everybody. Good, and then we're going to test them out as well. More posteriorly. Good. Right, so if I could have you just turn your head to one side and then the other. Okay, how does that feel? Any pain or restriction? Good. If you could bring your head up and down, try to touch your chin to your chest. Good. And can you do a lateral side bend? Tilt your head to one side and the other. Very good. And all of that felt normal? Wonderful. So, that is going to complete our head and neck examination. Now, did you have any particular questions, comments, concerns at all? Wonderful. So, I'm going to sign off on your chart. And that will conclude our assessment. like to thank you so much for coming into my office today to have this head and neck assessment. I hope you have a whale of a day and a good rest of your night. Thank you.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on